afternoon, good evening. It is Brian here from Expert Dojo. Again, you are in the pod and we are talking to another phenomenal entrepreneur who we have invested in. Only one objective of this podcast, and that is for other investors to get the down low on the diligence that Expert Dojo did on this phenomenal company that we already made an investment into. That's all we do, right? Bring them in, make sure the founders are here, make sure that we actually talk about everything that you need to know as an investor in the business, and we go from there. So, Krista, welcome to the show.
Thank you, Brian, for having me.
Yeah, of course. I invested in you. I love you. I love the company. I know you're going to do fantastic, and I'm absolutely delighted to share it with everybody else. So can we go back in time, like back to the beginning, and tell us the genesis of the idea behind Patientory? Like, what was it that made you realize I have to do this?
Well, it was really a culmination of like all my experiences. And I came to an aha moment and I was like, oh my God, this is it. So I actually started out in microbiome research and I was like, in a dark room and I was like, I don't think this is for me. Like I would literally count bacteria in a petri dish all day.
Wow.
As part of my research. Decided to go into hospital administration. So, started up a couple programs that worked in the community in upstate New York with mental health and associations and nonprofits that serviced about 10,000 people. From there, I went to business school and found myself in consulting, solving problems for people. And I realized that's what I loved. My whole set was on actually be a practicing, clinician, and fell in love with just the whole health IT world. So I started out in, implementing electronic medical records and did sales for that. That was really throughout the Obama administration when, the whole push for digitization of medical data was at the forefront, right? At just federal policy and initiatives. And then I got asked to join an early stage startup who had just raised their Series A. Mm-hmm. They were one of the first telemedicine companies. And I built out an insurance product within that company and managed that. We sold into employer organizations, right? This telemedicine product, which was way ahead of its time during around 2013, 2014. And our biggest challenge was always accessing patient data. So, fast forward, that company sold in 2017, decided to go out and start my own company. That's pretty much what I was doing, throughout my career and leading and managing projects in the healthcare space. And I decided to tackle the biggest challenge I had in my prior experience, which was patient access to data. And it was following Bitcoin, pretty early in that. And I researched the underlying technology and I was like, wow, this is what we need for healthcare. I studied and saw so many companies come and go and try to solve for patient access to data. We have big names like the Microsoft Health Vaults, the Box, and no one seemed to be able to come up with solid infrastructure for that. And that's where, the premise of blockchain really promises us this idea around democratization, right? Giving power back to the individual, which fully aligned with what we need for healthcare today.
I couldn't agree more. The challenge is the implementation, though, right? Because like every new technology that comes through, blockchain, Expert Dojo, to be official and unofficial and all kinds of anything you want me to say it, we are monster believers in blockchain, right? And we believe that when we look at the new infrastructure of the web, in the same way that TV went from like black and white to color, and in the same way it went from bicycles to cars, and all these wonderful things happen, we believe that the infrastructure of the web will evolve and it will just become stronger and better and more transparent. And blockchain is just a wonderful facilitator of that. Some things are harder though to bring absolute transparency in. And I know things like health records and data and those things have been talked about for a long time. And a lot of the challenges I think that folks have had originally was around the decentralization of much of the system anyway, and much of the records and pulling them into one place. So could you speak to maybe some of the challenges that you had with actually the system at the beginning, and then how you overcame those challenges in a wonderful and amazing way?
Yeah. So, when I started this, we made a white paper, and the first thing was like, okay, wow. Okay. So we have this idea on a paper. How are we going to get this medical data? So we spent about 2 years just trying to figure out, we went to hospital systems, realized we were not going to be successful by knocking on these hospitals' door and, saying we need to go one by one and connect and implement um, as a solution. Fortunately, interoperability has always been an initiative, in the space since electronic medical records. Um, I joined HIMSS, which is one of the main, nonprofits around health IT and the largest pretty much in our country. Ended up on their interoperability committee and board. And that's where I found out about, new regulations that were shaping up and taking place, which, we as a committee was able to provide inputs and insights into what is now the 21st Century Cures Act and the data blocking rule, and what has come out of that with what we call TEFCA out of, HHS and the federal initiative to be able to seamlessly share information, but also importantly, have individuals be able to access their data. So through that, networking, I was able to, really get in front of key players within the HIE space, so health information exchanges, and the big national ones today. That's part of that push for hospitals to adopt not only the legislation but frameworks so that companies like ours can, easily and seamlessly integrate into the EMRs. So that took about a couple of years, but
Because it was hard,
we finally
right?
made it. Yeah, it was hard.
And then talk to me about, and you got through that and past that and you built through. So then talk to me about as you started to build the company and develop the company and turn it into something bigger, and you started to raise money and bring in capital from the outside, as you were working through the challenges that there were in the beginning with bringing any great new technology to market, how were you also working on building the team and building up the investment coffers as well?
Yeah, well, that was also another challenge. It was just a challenge after challenge. But fortunately, we had great, I would say, marketing, especially just being in the Web3 space and one of the earlier healthcare companies in the space. We had a lot of people wanting to come and join our mission. Like they were really excited about this, and everyone understood it because it made sense, especially people that today just suffer from chronic diseases and have to manage their medical data and information. So we had a lot of people just come and want to join, most of which probably weren't a good fit. So that was hard to understand in the beginning. Yeah, so building up the team, we really try to focus on those skill sets that me personally I didn't have, more on like the technical side, and and the to go deeper into that security that we needed. And then on the investor side, some of our really early investors, and I talk about the angels, these were like angels at like CDC. So they were like really excited about that, and just seeing how their day-to-day work was impacted because of lack of information and quality data.
The great news here, everybody wants to solve this problem.
Yeah.
It's a huge problem. And because it's so decentralized and because it's so disjointed, this decentralized is actually too kind a way to say it, because it's so disjointed and so hard to be able to get data. And data is also a bit of a cold word. Like the warm word is the history on the challenges that Brian McMahon might have with his health in the future, so that Brian McMahon is able to live a happy and long life. Right. That's what you want to
Right.
know. And you want to be able to pull all of this together. So like the what you're creating is so beautiful and so nice that everybody wants it to be able to be done. Well, what have you learned over the years that has led you to a place where you feel more confident about it and more optimistic about it? Like, talk us through the journey. Like, the wonderful thing about the hero's journey is you start at the beginning, you come up with the idea, and then it's like Zorro, where you're like at the beginning of the movie, the baddie comes in with the mustache, and then the sword fight ensues, and then Zorro's on the ground and fights up. And that's at the beginning when you're trying to take all this disjointed information and bring it through. And now as we come around the hero's journey to the other side, you're winning. So talk us through now this next part as you're starting to break through, both on a funding side and also on a traction side to getting to the place that you want to get to.
Absolutely. We're definitely at that inflection point. I mean, we've gone through that valley, and I think you really have to appreciate that, because, at your lowest, you can understand, what your weaknesses are, what your strengths are. And we never stop taking interviews with customers, even investors, like they're our customer. And like you said it, Brian, everyone wants to solve this, right? Everyone is a patient, right? Everyone wants to live a healthier, happier lifestyle, right? So that's, something, a trend that we, always see when we have these discussions. And now that we're going to market, and people are excited about this, people from customers using the app, it's really starting to listen to their stories, right? And really understand, how this is impacting them, that we can also share this with other investors that come on, so that, everyone has that skin in the game, and can truly understand the magnitude, right? And the impact that we're building.
That's so beautiful. And then for the investors who are listening, who now go through the stage where they're saying, okay, so I want to understand how the traction is moving forward. So talk about maybe some of the proof points that have happened over the last while and that you are expected to continue going forward. And then we're going to dig into the team a little bit more.
Yeah. So, we started out thinking that, we were going to build this for the healthcare system. Fast forward, 2020 COVID comes around, and I got an email from a pharmaceutical partner saying, hey, are you willing to help us recruit? We have a client that, is in their clinical trial phase for the COVID-19 vaccine, and they're missing a certain number of people in the trial. And we're like, we really didn't think about this until more of a long-term strategy to go into pharma, because we just know, like, it's not the right time for pharma. So I ended up taking that meeting, and in 6 weeks, we were using the platform to help recruit for Moderna's clinical trials, and they did a whole press release around that. And that was really a game changer for us, because we started to see, that product market fit and the adoption of where this truly was. And I don't think anyone from a, patient portal, or just a patient, repository perspective has actually use this or actually come out with a viable business model. And that's where we started to look at this more as a, R&D and clinical trial platform. And we just started to go to more of these partners and sponsors in the pharmaceutical space and say, hey, you can use our platform to identify candidates for these trials that you're doing, and we can save you time. Fast forward, we've complete over 40 trials. We've matched over 2,000 people, right?
Wow.
To recruit, and we want to continue to grow on that. as well.
Wow. And how do you see that growing over 2023?
Well, as you said it, Brian, we know in our Monday meetings, our goal is 250% growth, right? So we currently recruit for about 15 pharmaceutical partners today, and our goal is to not only increase our capacity for trials, but also to really penetrate the market and bring on new partners and opportunities.
I love it. I love that you're focused on that 250%
Yeah.
growth year on year. That's a beautiful thing. Because,
Yeah.
by the way, investors, if you haven't been studying this, that's all you want. You want to find a company. If it could be somebody like Krista that's changing the world, that is what is called a Brucey bonus. You just got lucky, right? But you want underneath that to be able to see that 200% growth year plus year on year, so you can see that the company can then have a straight trajectory to getting to a couple of $1 million a month. And I love that Chris is right on target for that. And then so talk to us about the team. Talk to us about the people that you're surrounding yourself with to make sure that you can take this to the Series A round.
Absolutely. So I talked about myself previously, just coming out of that emerging tech, health, information, IT space, really passionate around bringing new solutions to impact healthcare delivery. My CTO, he's been on as well since the beginning, has more of that, over 20 years experience in big data analytics. So really early, within that analytics and machine learning space to really monitor our tech and usher in the technology from where it is and make it really applicable to the healthcare industry, right? Since we built our own proprietary blockchain network with over 20 patents, we already have about half of those granted.
Mm-hmm.
And then, we early on, because this is new tech, new market, a lot of our operations and marketing, we have a partner with Georgia Tech here because we were based in Atlanta, and Georgia State University Health Informatics. So, just really working with smart people, technical people that get healthcare informatics and information, even to our advisors who are former CEOs of health insurance systems, hospital systems. So it's been a great ride. And we have around 20 ambassadors. I don't know if you knew this, Brian, globally, that works on strategic initiatives within like their departments of health. So one of them, two in Dubai, right, that manages Dubai Health Authority. So, we're really looking at this not only from a strategic, but from a global perspective and really understanding healthcare, not only in the US, but in other parts of the world, and how this technology can have that impact.
I love that. And then so when you add on new members of the team, what positions are you filling for?
So with our next round of funding, we're looking to really build out of course, the C-suite, but our, senior management. So, we are hiring for VP of Biz Dev. We have over 60 organizations in our pipeline. So it's a lot for the founder to handle at this point. And just going to market and scaling and, really taking on, a marketing director that can manage our campaigns.
I
that
love
we have
that.
currently.
Embrace that 18-hour day. Embrace it.
Yeah.
That's what it is. That's the startup dream. You know that. And by the way, that's one of the things I also really like about you is the fact that when you're starting out a company, you have a choice, right? You can either overspend or bring in a ton of folks and run out of money, or you can underdeliver and try and do what you can do, or you can do what you do, which is cover a multitude of tasks, way more than would normally be possible for a mere mortal, and then make sure that you're continually pushing forward while at the same time making sure that you're keeping a total homage to the scientific side so that you can provide the service you need to for your existing customers. Very powerful. And the nice thing about like how you're dealing with your existing customers is it's helping you build a better and better product fit, because the more information they tell you, the more you know what your product should look like in the future.
Exactly. Yeah, that's golden, right? You always want, at least both myself and our CTO, we always strive to be close, to that customer base.
Yeah. And tell me about the investment side. What are the plans for investment?
So we were oversubscribed in our pre-seed. We raised over 1.5. We are currently just started with our seed, and really talking to investors and VCs around that. We have around 50% committed there. So we're raising 5 million on a convertible note, which will give us approximately 18 to 24 months to really start to bring on, those key accounts in our pipeline, that we can go to scale. So our goal is that Series A, Brian,
I
that
love
you
it. I'm here with
teach
you.
us.
And when are you raising that? I love that. You're ready.
Yes. Sorry.
And that's going to be, so you're going to do that raise straight away, right?
Yes, we are.
Okay, wonderful. And then when you get that money through, how are you going to break down how you're going to spend the money, and how do you expect that to impact the traction then as soon as you have it in and you got the people in place and you're ready to go?
Yeah. So as we know, our goal, 40% of that is definitely going to go to new hires. Um, as we mentioned, another 30 is for our go-to-market. So that marketing piece, especially being a new technology in the market. So really honing in and building our brand, and that consumer loyalty, which I think we have some already. We have over 20 combined, collectively, we have over 25,000 followers on our
Wow.
social media. Yeah. And the remainder operational costs and, just really tweaking the product as we start to learn more about those users, what works, what doesn't work with a product like Patientory.
Great. And then how do you expect that to affect traction both towards the end of this year and beginning of next year? Like, what changes?
I would say our goal, especially we have partnerships right now. So we have around 50K subscribers. Our goal is to, we have a partner that has over 23 million, right, consumers. So, our goal is really start to onboard those users. Again, get at least 100,000 conservative, right? It'd be great if we got even 2% of those, that 23 million users. And then the revenue traction. So we've been recruiting heavily for these clinical trials. We're now at a stage where we're now ready to look at other forms of revenue streams within that, right? To continue to meet those CROs and pharma where they are, and supporting those trials.
I love that. And then you will obviously bring the right members of the team in to make sure that the team joins. You've got the traction, which is covered. You've got the marketing, which is covered. And
Yes.
you've really got all the angles. So now I want to get to final two questions, right? Second last one, very easy. You're just going to give email contact details so folks can connect with you. But then the last one that I want to get to is the important one. And this is one where it's 5 years in the future. You're being interviewed by your very favorite TV channel interviewer, right? This is the news, the business news. You've just exited out of the company. You have done incredible things. You've actually maximized everything that you wanted to achieve in Patientory. So I'm going to ask you to summarize what happened in that interview. But before we do that, let's look at just get your email.
So my email is very simple. It's Chrissa at patientory.com. That's CHRISSA. Perfect.
And just spell out Patientory, please, just for everybody.
And that Patientory is PATIENTORY.com. You can also find me on Twitter. So I actively write on emerging tech for Forbes. You can reach out to me there, as well as LinkedIn, Chrissa McFarland.
Carissa, tell me, last question of the day, but this is an important one, right? You're being interviewed by, let's say, Bloomberg, right? They are talking to you about the incredible success you had in exiting Patientory. Now, whether you exited through an IPO or an acquisition, you're going to have to share. Also, you're going to also share the incredible things that you achieved through Patientory. You have to actually talk about every single thing that you wanted to achieve, that you did achieve through the company, through the exit, and just talk us through the end of the interview.
Yeah, so Patientory, 5 years in the future. So we've been acquired by a large tech company that has been trying to figure out healthcare. And the greatest thing, you know, and our long-term vision, which is being able to really break down the silos in healthcare and make it part of our everyday lives, which we are able to do because people are using this application and going to this application to understand more about their health, as well as being able to make money from it. So, you know, we've done what we've set out to do in really usher in this new internet and applying it to healthcare, which we know has always been at the lag in the industry and just adopting new innovations. So, you know, we were acquired. We currently, with this new acquisition, this will help us, you know, grow the app to meet, you know, a population of 2 billion people around the world who are using the application to, you know, really help them manage their health.
I love it. That is a beautiful thing. I'm so proud to have been a part of that incredible exit. Congratulations.
Thank you.
Carissa, it's been a pleasure. We're going to keep on rocking forward. Investors, you know how to contact Carissa. Otherwise, you can hit me up, brian@expertdojo.com. I'm very happy to speak about anything past, current, or future about Patientory. And otherwise, I just wish you all the very best on the journey, Carissa, and we'll be with you all the way.